Dear committee, dear audience, let me start with my thesis title, Eating and Feeding Difficulties in Children with Autism Spectrum Disorder from Background to Tailored Treatment. My name is Krisztina Szalkay. I'm a pediatrician and a child and adolescent psychiatrist. I work at Betesda Children's Hospital in Budapest. My vision is equality for autistic children and their families. My mission is identification of potential evidence-based therapeutic targets in autism with eating and feeding disorder. To achieve that, I have two ongoing projects. My first specific goal is investigating the severity of eating and feeding difficulties in autistic children with or without atypical sensory processing by conducting a systematic review and meta-analysis. Why is this topic so important? What do we know about the background? Autism spectrum disorder is a more and more commonly diagnosed neurodevelopmental disorder with a 2.2% estimated prevalence. About 80-90% of autistic people experience sensory processing issues, which is a part of the core symptoms of autism. The rate of eating and feeding problems in this population is extremely high, about 70%, and related to several medical and developmental consequences, and have a multidimensional etiology with an interaction between many factors. One of the four main factors is sensory processing. By now, the association between sensory disturbances and eating-feeding problems is evident. However, the latest studies could only confirm the significant role of oral modalities, even though our clinical experience highlights the importance of all other modalities as well. Despite its high frequency, the evidence-based therapy of this complex problem is missing. The autism-specific behavioral therapy by itself, in many cases, is not effective enough in the aspect of feeding problems. Maybe it can be due to the lack of the targeted treatment of sensory difficulties. So our aim is to understand the association between feeding difficulties and sensory integration in relation to all modalities. We asked, does atypical sensory processing in autism associate with the severity of eating or feeding difficulties? Our population is autistic children, exposure is atypical compared with typical sensory processing, and the outcome is the severity of eating, feeding difficulties. We hypothesize that autistic children with atypical sensory processing demonstrate more severe feeding symptoms compared to those without. I've conducted my systematic search in 4 databases, and after selection process, 49 articles were found to be eligible for our study. We can measure 3 different outcomes. The analysis regarding eating behavior inventories is finished. The other 2 regarding sensory profile inventories and correlation are still in progress. On the first plot, we analyzed the total and 2 subscale scores of brief autism mealtime behavior inventory, abbreviated BOMBI. This is an 18-item parent-reported questionnaire, employs a Likert scale for reporting the frequency of pathological behavior during mealtime, especially in autistic children, but it's also validated for neurotypical children. Higher score indicates a more severe feeding disorder, and the scale yields a total score as well as scores on 3 domains. So to analyze the total score, we used the results of 4 trials with a data of 355 patients. For analyzing subscale scores, we included 3 trials with patient number of 287. All studies are cross-sectional, comparing autistic and non-autistic children. In case of total score and limited variety score, the I-score shows a high heterogeneity, possibly due to the social and cultural differences of this population. We can't see any heterogeneity in case of disruptive mealtime behavior scale, probably because each subscale refers to the typical autistic symptoms, which are universal. We used mean difference for our statistical analysis. The overall score is 1.94. Clinically, it means that in all cases, autistic children had more severe feeding disorder, and with this nearly 12-point difference, their score enters the clinical category where greater and immediate support is required. The clinical meaning can be supported mathematically in case of total scale and disruptive scale. the difference is significant, we can see a tendency in case of limited variety scale. In the second analysis, with using standardized mean difference, it was more feasible to compare which domain exhibits the largest difference. For example, here, we can interpret the analysis the third, the food refusal subscale, which refers to the maladaptive communication strategy of children. In addition, with using a standardized mean difference, it was possible to include 3 more trials that used another instrument, namely Child's Eating Behavior Questionnaire, as one of its 8 subscales was found to be comparable with the Bambi Limited Variety Scale. This subscale is particularly relevant in our study as it precisely reflects to sensory processing. We included 6 trials with patient data of more than 700. The SMD value is 1.3, which is considered large, and as we can see, this is the highest value out of the 3 subscale values, so this result clearly confirms the importance of the sensory profile in mealtime behavior. So far, we were able to prove the association between eating difficulties and autism. We can give a new insight with focusing on the role of each subscale, especially limited variety score, and we created a clinical categorization based on this inventory. The limitations are small numbers of studies and the heterogeneity of measurement methods. Here we are now. I'm looking forward to see the results regarding sensory processing and correlation. So let me briefly introduce our second project, what is strongly related to our meta-analysis. We are planning a prospective observational multi-center clinical study about investigating the rates of autism and atypical sensory processing in children with eating feeding difficulties. Few more words about the background. So in autism, the rate of both eating feeding disorders and sensory disturbances is extremely high. The overlap and the association pose many challenges in clinical practice. Our study is focusing on the clinical phenomenon that eating problems are commonly the first signs of autism and appear well before the onset of the typical autistic behavioral symptoms. These noticeable, marked symptoms can easily mask the underlying neurodevelopmental conditions even for years or decades, leading to an insufficient therapeutic response to conventional therapies. The precision treatment of these patients is based on their complex phenotype. That's why diagnostic and intervention processes need to be executed by a multi-interdisciplinary team. Without this, severe consequences related to both untreated autism and eating problems is expected. So our aim is to clarify the rate of autism and atypical sensory processing in the background of eating feeding difficulties in childhood. We asked what is the prevalence of autism and atypical sensory processing in relation with eating feeding problems in childhood. So we are investigating 2 conditions, autism and sensory processing, in the context of feeding difficulties among children between 3 and 10 years of age, and we hypothesize that children with eating problems have higher prevalence of ASD or ASP. This study has important clinical implications, especially for patients, as early detection and personalized intervention decreases the consequences of eating feeding problems and autism conditions. For policymakers, the message is treatment requires multi-interdisciplinary diagnostic and intervention programs. So here is the summary of my 2 ongoing projects, and I would like to thank you for your attention. With brilliant thoughts of Piglet from Winnie the Pooh, the things that make me different are the things that make me me. Thank you very much.
It was very nice presentation.
Thank you.
Is Bambi inventory available in Hungary?
Thank you for your question. No, it's unfortunately not. But as a part of our second project, we would like to work with this, so we have requested a permission already for translation and validation. We haven't got the answer yet, but hopefully we will. Thank you.
Congratulations for a nice presentation. I am not really familiar with the autism, but I have a question for your second topic. Mm-hmm. I have seen that your population is from 3 to 10 years. How have you defined that?
According to many studies, this is a quite universal approach, because this can be a homogeneous population regarding to eating habits, regarding to eating behavior. So they are they have already implemented the solid foods, or they are over on this period, and they are not adolescent yet. So it's a quite homogeneous population.
Thank you.
Thank you so much for your presentation. My question has to do with that sentence when you mentioned that feeding and eating problems are usually one of the first signs. My question is, if a parent would ask you about this symptom, how to differentiate it between disturbances in the mother and child relationship, how would you help them to differentiate?
It is a very good question. Thank you very much. It will be our third project, to tell the truth. Yes, so as I have mentioned, this multidimensional background, it means that we have to investigate all in one place at one time. So we would like to follow this concept. We have to check. We have to do the evaluation of the neurodevelopmental status. We have to do the evaluation of the physical status, and we have to do the evaluation of the parent-child relationship. Of course, the neurodevelopmental disorder influence the parent-child relationship, and many of the parents have autistic symptoms as well, so it's very complicated. But with these four dimensions, I think we can give a comprehensive picture.
Brilliant, thank you.
Congratulations for a nice presentation. I was wondering that this complex examination is available somewhere in Hungary?
Thank you very much. As far as I know, there are two centers here in Budapest. One is in Heimpál Hospital, and the other one is in Betesda Children's Hospital. So, but as far as I know, Betesda Somatomental Department, that is the name of this department, is the only place where this one place, one time concept is available at this moment. So,
thank you so much.
As I know. Thank you.
Thank you for your excellent presentation. My question is regarding to your second project. My question is that do you plan to provide same quality and quantity food for the participants? Because I think that it can also influence the eating patterns.
Quality, quantity food?
Food, yes.
Yeah, I think dietary intake should be measured as well. It can be the fourth project, I don't know. So if you have it's very hard, because due to their selective eating, it's very hard to provide. So it's dietary advice is not effective enough by itself, I have to say. But in this program, what we work in, there is a dietitian, yes, and yes, of course, they get dietetic advices. Yes, of course.
Thank you.
Thank you.
The very last question.
Yeah, thank you for the presentation. I joined to the question of Tibor and Luca. So, from the view of dietitians, what we can do? How can we recognize the difference between eating disorder and autism eating disorder, and what can a dietitian can do in this case? So do you working together with dietitians
Yes, as I have mentioned, yes. So dietitian is in this multidisciplinary team. So we are sitting together around the child and around the families, and we are trying to understand that child with their eating problem, with their parents, and help them.
It's a special solution in every case.
Yeah.